I can remember that when I was deciding what did I want to do with my life when I was probably just a teenager, I said, I think I'd want to do something that gives me a good purpose, a good feeling about that I'm accomplishing something every day. And so being a physician and a surgeon, I get that every day in, day out. I feel like I'm helping someone get better, improve their life. And it's a very rewarding thing, and in retrospect, after 20 years in practice, I'm very happy with my choice. I always advise that the patients should go to someone who they feel comfortable talking with. You're dealing with very personal situations. Oftentimes it's the worst time in their life, someone who's not used to being sick or someone who's in pain. And I think that it's very important that they be able to connect with the person they go to and feel free communicating, to feel that there's a good exchange of information, that things are getting explained. I think that's critical. And I think that when you have that, when you connect with a physician, that someone that you feel comfortable dealing with, you actually get better quicker. I think it helps your overall health care, and I think it helps your recovery with surgery. I was at Christian Hospital for maybe 8 to 10 years, and then an opportunity opened up here in St. Charles to join a practice here in St. Charles. The practice I was with merged. When I met the doctors who practiced out here, they were all dedicated, vital, passionate physicians, and concerned about the welfare of their patients. And so the opportunity to work with the primary care physicians and specialty physicians out here was a great opportunity for me, and I have not regretted it. I think I've been out here for well over 10 years now, and it's still growing, and I still enjoy practicing out here, and we still have a great cadre of physicians, caring, passionate physicians that I work with every day, and so it's been very rewarding being out here in St. Charles. I grew up in Baldwin, in West St. Louis County, and so my first job was at Six Flags of Mid-America, and I still remember this. I was working in a taco stand, a Mexican restaurant, and I had to wear these little knickers and I don't know, some sort of a costume, which was kind of dorky, but I remember that part of it. And that was my first job, and it was a tough job. It was hot, you know, the food service and can be difficult, but what it does do is give you contact with people every day, and I think that was a great experience for me. I do like to play golf. You know, the doctor who plays golf seems like a cliche, but I do enjoy golf. But I also have some more, maybe less conventional things. One of my passions is snowboarding, and I don't get a chance to do it that often in the flat land of the Midwest, but I can go to Hidden Valley and Eureka, and several times a year I might go out to Colorado or Utah and do snowboarding. I also like to do windsurfing. And so, again, not a lot of places do windsurfing around here, but I travel to Padre Island in Texas to do windsurfing, and that I have a great time learning. I'm not very good at it, and I take a beating, but I love to do it. I'm an avid reader, and so I'm always reading something. And one of the interactions I have with my patients, a lot of my patients are readers too, and if they're in the waiting room, they're reading a book. And so if they're reading a book, I always ask them what book they're reading, do they like it? And so a lot of the books that I read are recommended by my patients, and we have a nice, with my patients over the years, we have almost like a book club where we recommend books to each other. I recommend books to them, they recommend books to us. In fact, one of my patients just finished reading a book and says, I want you to have this, doctor. I really enjoyed this book, and this is for you. And so I'm going to read that one next. Not many people know, or they may think that urology is just for men, but I and most urologists, a big part of our practice is women. So if I was to share about the men, I think one of the most important things, issues that I would share is PSA screening tests. The prostate-specific antigen is a blood test which screens for prostate cancer. And there's recently been a lot of controversy about it, and there's been some recommendations against screening for prostate cancer. I totally disagree. I think that there is no doubt that screening for prostate cancer has reduced the prostate cancer deaths. And in fact, if we did screening correctly and everybody did it, there would be no prostate cancer deaths, in my opinion. The reason that prostate cancer is so dangerous is that it does not have symptoms. In almost every case, prostate cancer does not give you any warning signs or symptoms. And it is the most common cancer in men. Almost 250,000 men a year get prostate cancer. The risk is 1 in 6 for all men in this country, and you don't get any warning signals. And that is why PSA screening for prostate cancer is so important. So now on to the women. The women, the message I would say is the problem I treat most commonly in women is urinary incontinence, and that's leakage of urine. Almost all women who have had a child before have some degree of it. It can range from just being a slightly annoying problem to something that's life-limiting, to where a woman will not do the things that she likes to do because she has to deal with an incontinence problem. And I would say that absolutely you do not have to put up with this. There are treatments, there are procedures that can, quote, cure that problem and give you your life back. So don't hesitate. Don't think that there's nothing that can be done. Please go to your urologist, and we will help you get your life back.